Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? This is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. Folks, it's a Monday. We are literally weeks away from October, and the craziness has, in fact, begun. Folks, I'm just really excited about it. I just love Medicare open enrollment period, and maybe it's just because I am a nerd, right? I'm an insurance nerd, and I'm in it. I mean, it's my life. It's my life. I love working with people. I love talking with people. I'm just really excited about it, and I'm actually really excited about this episode here today that we need to bring to you about the new program known as the Medicare Senior Savings Program, and it's the Medicare. It's a new senior savings model that's going to impact insulin and insulin drugs in 2021. Now, you're going to have to stick with me all the way through the end on this because it's going to get a little complex, and we're going to do our best to kind of explain it through as we go. But folks, as long as I've been doing this, prescription drugs have been a problem. There's been the donut hole. And the donut hole has, since the name anyway, has gone away, and now it's referred to as the coverage gap. But I remember when I first came into the business and I first started working with people, the donut hole was the most feared Medicare thing that people on Medicare paid attention to on a year-to-year basis. And it's mainly just because if you're not familiar with what the coverage gap or the donut hole is, it is a stage in drug coverage. I've said it before and I'll say it again. Medicare essentially has stages of drug coverage. And if you enter this stage called the coverage gap, formerly known as the donut hole, your prescription drug costs typically end up going up and rising. It's almost like, if you can think of it like this, it's a very backwards model if you really think about it. It's almost like if you were to buy groceries at the grocery store. Let's say that the grocery store was keeping track of your cost of groceries throughout the year, and once you've spent a certain amount on groceries in the year, they raise your prices. I mean, it's almost as backwards as that, because that's what the donut hole, aka the coverage gap, was and still is to this day, to where you would basically be put in a situation where they track the total cost of your medications throughout the calendar year. And once you've reached a certain amount on those medication costs, this year in 2020, it's around $4,000, you end up entering this stage of coverage and you end up paying 25% of any medication. Now, insulins particularly are very expensive prescriptions. Some can be $500 a month retail value, because the retail value is what gets you into the coverage gap. It's the total cost of your prescriptions, what you pay, plus what the insurance company pays. I really need you to stick with me on this one. Now, insulins can be $500 a month retail value, $1,000 a month retail value, depending on if you're talking about Humalog, Novolog, Tregeo, whatever it might be. It is one of those things that is insanely expensive. It's expensive for you, the consumer, but it's also expensive for the insurance company. And what is the coverage gap if not a basic loophole for the insurance companies to get out of paying for them after a certain point? Or maybe not get out of paying for them, but get out of paying a large chunk of them. I've talked about on the show that there was some new regulations that might have been coming out about insulin costs and capping them at maybe $30 for a 30-day supply. Well, we have something now going into 2021 that will at the very least be an option for that. Don't go anywhere, folks. I have to take a quick break here from this week's sponsor. But I'll be back in segment 2, and I'll go over exactly what this new program is, how it works, why you have to know about it, why it matters, and the whole 9 yards. Don't go anywhere. We'll be right back. Welcome back, everybody! Thanks so much for sticking with me through that break. This is episode 219 of the Everything Medicare Podcast, where every single week, I, your host, Christian Brindle, bring you a podcast episode on Mondays where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. And folks, today we're talking about the new senior savings program that basically caps insulins. So basically, this is the way it's going to work to my understanding. Now, we're not quite to October 1st yet, and usually with changes to this magnitude, I'll typically kind of learn a lot about them as we go, and I'll certainly learn a lot of them surrounding the first. But to my understanding, this is basically the way it's going to work, and I'll kind of read you what Medicare has put out. Starting January, seniors using Medicare Part D, which basically could be Medicare Part D prescription drug coverage included in a Medicare Advantage plan. So it's not just Part D that you might pick up to go with a Medicare supplement, but I digress. Seniors using Medicare Part D will be eligible to purchase their monthly prescriptions no more than $35 a pop when they choose one of the participating plans, mainly due to insulin. This is estimated to save an average of $446 in annual out-of-pocket costs per insulin for a person on Medicare. So that's very big news. Now, before you jump up and down for joy, just understand that, like it said, certain Medicare plans, so not all Medicare plans are going to participate in this program. They're not all going to. We might see more and more of them start to participate in it as it kind of picks up steam for the years to come. But at this point, only certain ones are going to participate. But from my understanding anyway, what this means is this: that even if you enter the coverage gap, you'll be capped at a $35 copay for select insulins. Now, I was looking at some of the benefits on some of the new plans for 2021, and I can't tell you anything specific, but I have seen on some of them, it says that it's for select insulins. So I'm anticipating that it will only be certain insulins. So it could, hypothetically speaking, be Humalog, but maybe not Trigeo. Or maybe it might be Trigeo, but not Novolog. So we're going to have to see how this goes, but if you're a diabetic and you take insulin on a month-to-month basis, this is a huge opportunity for you. This is a very, very big opportunity for you, folks. And it's something that you need to be aware of. Now, like I said, not all plans will participate in it, so you might want to ask your insurance agent if you're a diabetic and take insulins, if your plan participates in it. If you're not sure and maybe you don't believe in your agent, don't know who they are, let's say, and if you live in one of the 12 states that we work with people in, you're welcome to contact my office. We work with people in Utah, Idaho, Colorado, Oregon, Washington, California, Texas, Virginia, West Virginia, South Carolina, Alabama, and Florida. Our office number is 801-255-5340, 801-255-5340. Folks, I'm really, really excited about this because I think that it's going to be a great opportunity for people that are on Medicare that take insulins. And I just think I think more than anything, insulin costs have plagued people on Medicare for as long as I can remember. And it's been a horrible thing. It's the pharmaceutical companies have gotten away with murder. The government has put out programs that mainly protect the insurance companies, but I understand it from their perspective. I kind of more blame the pharmaceutical companies than I blame anybody. Because if you look at the amount of money it costs them to make it compared to what they sell it for, it's criminal almost. And they only do it because they are allowed to, and they do it because they come from the perspective of this. Hey, you need this insulin, and you can only get it from us. So if you don't buy it, your health is in jeopardy. you might not survive. So how much is your life worth to you, essentially, is what the pharmaceutical companies do. It's twisted. It's evil as far as I'm concerned, and I don't condone it. I don't believe in it, and I don't like it, and I think this is a step in the right direction to kind of reeling things back in to kind of keep it a little bit under control. I like the program. We're going to have to see how it goes. I'm hoping that it doesn't cause premiums to rise on Part D plans, and I hope it doesn't cause other things to deteriorate in terms of the plans, but so far, I'm pleased with what I see. Folks, I hope you enjoyed this episode. We have some unbelievable episodes that we're sitting on that are going to come out starting October 1st once we can really tell you some juicy stuff, and I'm just really excited about it. You're not going to want to miss them. But if you're listening to us on a platform that allows you to do so, and if you've been a listener of us for some time, please do us a favor. Drop a 5-star review. Maybe drop a little comment on what you enjoy about the show. It helps us reach more people just like you who need to hear our message. We love you. I love you. And I hope this is some great news, though, and I couldn't wait to share it with you. We'll be back with you with another episode that next Monday will be our final episode before the October 1st rolls around. Have a great week. Take care, and happy Monday.